Hello everyone and welcome to Forensic Extract, and today's topic is about metallic irritants. Metallic irritants. So among metallic irritants today we will cover arsenic. So arsenic is the metal which is poisonous, and it is frequently asked long question as well as different MCQs in different PG entrance examination from this topic especially. Arsenic is known as the king of poison. The king of poison. And it is also known as poison of king, poison of kings, because it was used for killing of various kings. So king of poison or poison of king is the name for arsenic. Now something about toxic salts of arsenic. So toxic salts. So arsenic is having both inorganic as well as organic salts. Inorganic salts of arsenic are more poisonous as compared to organic salts. So these are more poisonous as compared to organic ones. Now first salt is arsenic oxide. So it is also known as Sankhya or Somalkar. Somalkar. Sankhya and Somalkar is the other name for arsenic oxide. It is the salt that is white, tasteless, tasteless, and any without any odor. So it is white, tasteless, and odorless salt of arsenic. Now we are having arsenic trichloride. So it is known as arsenic trichloride, and arsenic trisulfide. It is also known as mineral or piment, or especially in India, it is known as hartal. In India, arsenic trisulfide. And one important compound of arsenic is copper acetoarsenate. It is also known as Paris green. Paris green. Paris green is used as a pigment and as an insecticide. Insecticide. So copper acetoarsenate is a salt of arsenic and copper, and it is also known as Paris green. And copper arsenate, it is known as Shelley's green. Shelley's green. So these are the toxic salts of arsenic. Now we'll discuss about mechanism of action of arsenic. So first of all, the mechanism of action of arsenic is that arsenic binds with sulfhydryl groups, and that's why it inhibits cytochrome C. So this is the main mechanism of action of arsenic, similar to other metals, and it promotes apoptosis of cells, apoptosis, by causing degeneration of anti-apoptotic factors. It promotes apoptosis. So this is the mechanism of action of arsenic. Now something about toxokinetics. toxokinetics means the absorption, distribution, and excretion of arsenic. So arsenic absorbs well from GIT and from respiratory tract as well as from skin. So it is well absorbed from GIT, respiratory tract, and skin. Now the distribution, it distributes in liver and spleen and kidneys. So distribution, it distributes in liver, spleen, and kidneys. Arsenic does not crosses blood-brain barrier. It does not crosses blood-brain barrier. It only distributes in liver, spleen, and kidneys. And it also accumulates in the tissues which contains keratin. So keratin containing tissues like nail, hairs, and skin. So these are keratin containing tissues in which arsenic will accumulate. Now the final stage, that is excretion. So arsenic is excreted from mainly from kidneys. This is the main excretion, and remaining arsenic is excreted in bile or feces and sweat. So this is the toxokinetic of arsenic, that is absorption, distribution, and excretion of arsenic. Now sign and symptoms of poisoning of arsenic. Sign and symptoms. So arsenic poisoning is having characteristic smell, that is garlicky smell, garlicky smell, and the person is having metallic taste, garlicky smell, and burning and colicky pain, colicky abdominal pain. So burning sensation and colicky abdominal pain, garlic-like smell, and metallic taste are the features of arsenic poisoning. Now later on, the watery diarrhea is seen, that is similar to rice water stools of cholera. So the watery diarrhea is similar to rice water stool that is seen in case of Vibrio cholerae infection. And arsenic also causes irritation of mucosa. So due to mucosal irritation, there is congestion of conjunctiva, congestion, and inflammation of various mucous membrane inflammation. So that is also seen in case of arsenic poisoning. Now it also causes various arrhythmias and ST and T changes in ECG. ST segment and T wave changes are in ECG are also seen, and QT prolongation is also seen sometimes increase. So these are the signs and symptoms of arsenic poisoning. Now what happens in arsenic poisoning? There are various lines. These lines are known as Eldritch Eldritch Mees lines. Eldritch Mees lines are seen in arsenic poisoning. These are multiple transfers like this. These are transverse 1 to 2 mm white striations in the fingernails. So these are the multiple transverse white striations in the fingernails. These are known as Eldritch Mees lines. this is important finding in arsenic poisoning, but it is only seen in 5% cases. Only in 5% cases. So these are the lines which are characteristic of arsenic poisoning. Now we have to differentiate arsenic from cholera. So arsenic poisoning is different from infection of cholera. That is, what happens in case of arsenic poisoning, the vomiting is always there before purging. But in case of cholera, there is purging followed by vomiting. Because it is an infection of intestine, so always there is purging, then there is vomiting. And vomitus in case of arsenic poisoning contains blood and mucus. Vomitus contains blood and mucus. But in case of cholera poisoning, vomitus is already watery. Watery. And the stool is dark colored stool. Initially in arsenic poisoning, stool is dark colored, and later on it will be like rice water stool as seen in cholera. But in case of cholera poisoning or cholera infection, Vibrio cholerae infection, the stool is like rice water. So rice water stool are characteristic of Vibrio cholerae infection. Then on laboratory diagnosis, obviously arsenic will be present in serum as well as in urine and various tissues, keratin containing tissues. Arsenic will be present, and Vibrio cholerae can be detected in case of infection by Vibrio cholerae in case of cholera. So Vibrio cholerae detection. Now, usually arsenic poisoning is seen in one or two people, though single involvement is more common in arsenic poisoning, but several persons are involved at a certain period of time in case of cholera poisoning because of the infection by Vibrio cholerae. So this is the basic difference between arsenic poisoning and the cholera. Now we'll discuss about the chronic arsenic poisoning. Chronic arsenic poisoning. So what happens in case of chronic arsenic poisoning? There is different stages of arsenic. As we all know that arsenic is a teratogenic metal. It's teratogenic, and the chronic poisoning is divided into various stages. The first is the gastrointestinal stage, GIT, in which there is loss of appetite, and gum swelling will be seen, gum swelling, and nausea, vomiting, and diarrhea will be seen initially. So this is stage one, that is gastrointestinal symptoms. Now this stage two of chronic arsenic poisoning is the dermatological stage. Dermatological stage. What happens in case of this stage two? There is hyperkeratosis. There is hyperkeratosis. Especially this hyperkeratosis is seen over palm and soles, and later on there are chances of formation of or the cancerous growth in that hyperkeratotic lesions, that is known as Bowen's disease. Bowen's disease. So cancerous growth in that in these hyperkeratotic lesions that are caused by arsenic is known as Bowen's disease. And characteristic lesions like visible in the photograph are known as raindrop pigmentations. Raindrop pigmentations. So these pigmentations are seen in arsenic poisoning. These are numerous rounded, multiple hypo as well as hyperpigmented. These are hypopigmented and these are hyperpigmented macules. So mostly these macules are seen over trunk and bilateral extremities. So these are the raindrop pigmentations. So this is stage 2. Now the stage 3 of chronic arsenic poisoning, that is the neurological manifestations. Neurological. In neurological manifestations, there is anesthesia, paresthesia, and hyperesthesia is seen in case of neurological manifestations. And finally, there is neuromuscular manifestations, in which there is ataxia, muscular atrophy, and foot drop and wrist drop. Foot and wrist drop is seen in case of chronic arsenic poisoning. So that's why there are 4 stages of chronic arsenic poisoning. First is the gastrointestinal symptoms, then the dermatological and neurological and neuromuscular disorders. So that's why foot drop and wrist drop is seen in chronic arsenic poisoning. So it is a differential diagnosis of lead poisoning also, because it is characteristically seen in lead poisoning. So we have to differentiate arsenic poisoning from lead poisoning. So now the fatal dose and fatal period of arsenic, that is the fatal dose of arsenic trioxide is 200 to 300 milligram, or the arsene gas, the level between 25 to 30 ppm level of arsene gas is fatal, and the fatal period is between 1 to 2 days. Within 1 to 2 days, this arsenic is fatal. Now, how to diagnose arsenic poisoning? Laboratory diagnosis by measuring urine arsenic level, urine arsenic levels, and measuring arsenic levels in various keratin containing tissues like nail and skin and hair, in which we can measure arsenic concentration. Now, the management of arsenic poisoning. So, how to manage a case of arsenic poisoning? First, we will go for the general precautions, as well as the removal of unabsorbed poison, that is by gastric lavage with warm water, or we can also give activated charcoal, or we can go for whole bowel irrigation in case of high dose injection. D-penicillamine can be tried. D-penicillamine as a chelating agent, and newer therapy as for the arsenic poisoning are immunotherapy. Immunotherapy is prepared by combining arsenic acid with carrier protein. So arsenic acid is combined with the carrier protein, and that complex is injected in a mice, and then the active immunoglobulins against arsenic are prepared, and these immunoglobulins are used for the management of arsenic intoxication, arsenic poisoning. So this is the newer advanced therapy, that is immunotherapy. Now the postmortem findings in case of arsenic poisoning. Mucosa, whether gastric mucosa or any other mucosa, is markedly congested and inflamed. So mucosal inflammation, mucosa will be inflamed, and characteristic mucosa, that is known as red velvety mucosa, red velvety mucosa. It is characteristic of arsenic poisoning. Mucosa will be red velvety color, and there is submucosal, and subperitoneal hemorrhages. So submucosal and subperitoneal hemorrhages will be seen in case of arsenic poisoning, and subendocardial Subendocardial petechial hemorrhages are also common in arsenic poisoning. So these are the postmortem findings. Now the medico-legal importance, MLI of arsenic. So arsenic is used by some person as the aphrodisiac, because arsenic is aphrodisiac, so that's why it is used by some person, and it is tolerated up to the dose of 300 milligram and even more. 300 or more uh, dose of arsenic is tolerated by the person who are continuously using arsenic as aphrodisiac. So these are known as arsenophagist arsenophagist. Now, one disease, that is the peripheral vascular disease, which is seen in Taiwan especially, or that is known as black foot disease, in which there is blackish discoloration of bilateral foot. That is a peripheral vascular disease caused by arsenic poisoning. And sometimes the postmortem imbibition is seen in case of arsenic poisoning. So the defense may take the plea that arsenic had leached into the body from surrounding soil. So arsenic has reached from soil in the body. So this plea can be taken by the defense in case of arsenic poisoning. But there are two explanations. One is that the form in soil, the form of arsenic in the soil is not soluble. So this leaching is not possible. Then the second explanation is that concentration in the body cannot be more than the concentration is in soil if the arsenic has leached from soil to body. So these are two explanations of postmortem imbibition. Now sometimes employer is liable to pay compensation. So, employer's liability to pay compensation in case of occupational exposure of arsenic. So occupational exposure of arsenic, the employer is liable to pay compensation in case of arsenic poisoning. So this is all about chronic as well as acute arsenic poisoning, and the various MCQs as well as long question as well as short notes are uh, asked in the various UG as well as PG examination. So this is all about arsenic, and soon we will cover other remaining topics. So thank you guys, and please do subscribe, and thanks for subscribing Forensic Extract.